Okay, moving on to the axial muscles. These are muscles that are going to attach on either the axial skeleton or the skin. And the muscles in particular in table 6-1 are muscles that are going to attach to the skin. So they don't necessarily cross a joint, but when they contract, they cause a movement of the skin, which results in different facial expressions. So the first muscle listed is the frontalis muscle. And there's two muscle bellies here. And you'll notice on your white sheets it says occipitofrontalis, and that is because there is a tendinous sheath that runs along the top of your head. If you notice, you don't have any muscles up there. But then it continues on as the occipitalis muscles in the back. So those two sets of muscle bellies and that tendinous sheath form what's called the occipitofrontalis muscle. So the frontalis muscle, when it contracts, it's going to draw your scalp forward, almost in a scowl. And the occipitalis is going to do the opposite. It's going to draw your scalp backward. So other than raising my eyebrows, which the frontalis can do, the occipitalis apparently has that action as well. I don't know about you, but I cannot seem to get my occipitalis to work. I don't even know if I have one. I know people that can use it to do all sorts of things with their scalp. So the next muscle is the orbicularis oris, and this is a circular muscle surrounding your mouth, and it is responsible for pursing your lips or for kissing. And the orbicularis oris, orbicularis oculi is your muscle responsible for closing your eye. So not necessarily opening it, it's for closing your eye. So it's your half of a wink muscle. And then this muscle right here is an interesting muscle. It's a flat sheet-like muscle, and it extends from the chin down to the chest. And when it contracts, it makes you really good looking because it makes you do this. So you can see, oh, I need to work out my platysma, but because I can't see mine as much. But yeah, it is that pulling down of your lower lip like that. That is your platysma. And the platysma can also depress your jaw. And depression of the jaw is just your jaw opening. That's considered depression of the jaw. And then we have the zygomaticus major and the zygomaticus minor. And like their name suggests, they're in the zygomatic region. So I'm going to hide my orbicularis oculi. I'm going to hide some of these muscles here. So the zygomaticus major is listed first, and it is the bottom of the two muscles. So you have a zygomaticus major and a zygomaticus minor. The major is the one that is more inferior and lateral, and its action is to help you smile. So it's going to pull the corners of your lips up and help you smile. So that's the zygomaticus major. The zygomaticus minor is more superior and I guess more anterior, and that is your snarling muscle. So pulling your upper lip up, that is your zygomaticus minor. And then the last facial muscle that you need to know is the buccinator. You can say it so many different ways. The buccinator, the buccinator, however you say it, just make sure you spell it right. So I'm hiding a bunch of muscles here in order to show you the buccinator. In fact, I don't even know how I say it. Buccinator, it doesn't matter. Anyway, this muscle, although it does cross over your upper and lower jaw, its job is to keep food in between your teeth when you chew. And it is also your fish lips muscle. So when you suck in like that, that is using your buccinator muscle. It's also the muscle that babies use when breastfeeding or sucking on a bottle. So buccinator button. So button. I was going to say cute as a button when you put your finger in your dimple and say, you know, you're cute as a button. You're touching your buccinator.